Well, hello and welcome to all of our viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, today we're back again talking about our upcoming GOLD Lactation Online Conference 2022. And boy, is this an important event this year. We've got incredible response from many of you who have already registered for this event, and we're so excited. So many great topics, lots of clinical things that you can put into practice right away. So it means you can come to the event and start putting things into place for yourself and your clients immediately, which I know so many of us really want these days because we want to be practical and pass on the message. We're all about education and educating our clients. So that's what's exciting. And as you can see today, we've got Kristin Cavuto, who is here with us. She's actually got a really important topic that she's going to be sharing. Kristin and I were just talking about it and the importance of her topic, but I'm just going to leave that there for a minute because I want Kristin to go ahead and introduce herself to you and tell you where she's from in the world. So Kristin, go ahead, please.
Hi, so I'm Kristin Cavuto. I am in Edison, New Jersey, which is in central New Jersey on the east coast of the US. I am a licensed clinical social worker and IBCLC in private practice. So I see people for therapy and I also see people as a lactation consultant.
Wow. I mean, I was just thinking about this whole premise of being a licensed social worker as well as an IBCLC. And I'm starting to see more and more of this, Kristin,
Mhm.
but the importance of the work that you do, because we know there's lots of things that happen in the perinatal period, pre and post birth, that we're talking about and how to protect those clients. So I actually find this quite exciting because, I want to learn more from you and all of those amazing social workers out there in this particular area. But can you tell me, how did you get into this? Like, how did these two fields collide?
Sure. So I went right through school and got my master's in social work, at a very young age. And I had a perfectly lovely career as a therapist. I was working in addictions, I was working in rehabs and very happy with that. And then I had my first baby. And I joke that I'm sort of like one of those kids who had cancer and then become an oncologist
Mm,
when they grow up. I definitely became a lactation consultant because I had such a hard time nursing my first,
right.
and I didn't get the help that I needed.
Okay.
So while I was home with my kids for a few years, I became a volunteer breastfeeding leader and then said, well, I think I should go take some classes and see if this is what I want to do for my career. So I went back to school and did all the things I needed to do to become an IBCLC. And I found that the two careers really complement each other beautifully.
Hmm.
Um, so much of what we do is counseling skills. And so I felt like I came into it with already, really ahead of the game in terms of understanding how to create warmth and empathy with clients
Mm,
and how to create that connection. And, we know from research that clinical competence is very important, but the only thing more important than clinical competence is a sense of warmth and a sense
mm.
of connection with our clients. And that's the most important thing with a therapy client or with a lactation client. So that's definitely that connection, that relationship is sort of the first thing that I develop. And then we go on to, clinical skills after that. Yeah, I love this work. I would say that what's actually interesting now is in my career, I'm in the middle of a fellowship right now in infant mental health.
Ah,
So it's a
yes.
sort of perfect marriage of my two careers where we're talking explicitly about the perinatal year and even 0 to 3, but mostly in that
Mm,
first year during pregnancy, birth, and the first year postpartum, and how that infant develops a basis of good mental health and how we can, how that can be upset. And
mm.
so that's one of the things I think going forward is going to be a real specialty for me, is talking about
Oh.
how to take care of our babies and set them up for a lifetime of good mental health.
Oh my gosh, that is just amazing. I've always been so drawn to that field of infant mental health. I think it's such an underserved area as
Mhm.
well. And when I start, reading about it and talking to people about it, I just get there's almost this sense of, just wanting to dive deeper into it because it is the framework of our entire life, relationships,
Yep.
how we are, how we're wired,
Hmm.
but I also love teaching my clients early on, from the time that the baby is in utero to how the baby is immediately handled after birth, because that's my doula heart, I have to say.
Hmm.
So I just love all those things. Oh my gosh, we're going to have such a good time together, Kristen. That's amazing. Thank you for doing that work, because it is for a lot of people undiscovered. So you're going to become the
Yeah.
voice, right,
Well,
of
what's
this?
interesting is what I'm bringing to the infant mental health profession is the lactation piece, and they don't have
Ah,
that. In my
oh,
fellowship, I'm the only lactation consultant. I'm the only person
really?
talking about lactation. Yeah.
Oh,
So
wow.
what's interesting is so much of what I'm learning
Yeah.
from an academic perspective now, but I already learned it as an attachment parent and as a breastfeeding
Yes.
parent. So it's things that I'm being reinforced clinically and professionally that I knew from having my babies and taking care of my babies in a detached way. So
Yeah.
it's actually really nice to see that and to bring that perspective to the class I'm working with. So
Oh,
I'm
I
sitting here
bet.
and it's a multidisciplinary field. So there are therapists, there are childcare workers, there are people in policy, and so
Hmm.
I get to bring the lactation perspective, and that's new to them. They're pretty excited about it.
Oh, that's so cool. I love
Yeah,
hearing those stories, because it just means that, you're like a kid in a candy store. All of a sudden you're like, here, I've got all these things
so
to share
much.
with you.
Yeah.
Oh, that's awesome. Good to hear. Good to hear. And I also see, like, from your bio, which is just incredible, I have to say, Kristen, seasoned speaker. It looks like you love speaking about this topic
Mhm.
and other mental health issues as well, around the globe, and so many opportunities there for folks to listen to you. And you're active in the LGBTQ arena as well. So many things I see on here: an activist and a parent of teenagers. That's
Mm.
going well.
Mhm.
Yeah.
Yes, yes, it's going well. I have one starting high school next year and the other one starting to look at colleges.
Oh my
So
gosh.
I
Yes.
know it's not
Keeping
allowed.
you
It's
busy, keeping you busy. That's
yes.
awesome. That's awesome. All right, let's dive into your topic a little bit. I know we've talked a little bit about how important this topic is, how it keeps coming up, and folks are asking for it. And we're really grateful that you're able to,
Mhm.
be here with us this year and put this together. So the topic at hand we're talking about is eating disorders in the perinatal client, a trauma-informed model. So maybe you can just give us a couple of snippets on what to anticipate for this topic at the lactation conference this year, Kristen.
Sure. So it's interesting. We're going to be talking about eating disorders in a variety of ways. So what people will be able to bring to their practice right away is being able to obviously identify symptoms of eating disorders, identify specifically what those symptoms look like in the perinatal person. And it looks sometimes very different than it looks like in someone who isn't pregnant or who hasn't given birth in the last
Gotcha.
year. So we're going to be looking specifically at how eating disorders can manifest in someone who's pregnant or postpartum. Um,
Mm,
and then we're going to talk about practicalities. How do we use screening tools to help someone who we may suspect have this eating disorder? What kind of helps are available? And how do
yeah.
we get people the help they need? And the entire presentation is centered in looking at centering marginalized people and looking at our experience through a trauma-informed lens. So
Mm,
what that means is that we're going to be talking a lot about how people's trauma histories, both their individual trauma histories and their generational trauma that they may have experienced, impacts their life and impacts the likelihood of them having an eating disorder.
mm. Oh, I really appreciate that. That answers one of my questions, was what is that lens, and or what does it mean, a trauma informed model?
Mhm.
I just feel, Kristen, if I can be completely honest, that
Mhm.
the last 20 years my practice has changed so much in
Mhm.
lactation, and one of the areas I haven't felt as well prepared in is this particular area of eating disorders. It's not something I'm totally familiar with, and but having a better recognition of it. But I think, understanding, I'm looking through the lens of trauma informed model is going to be so valuable,
Mhm.
because then you can be open to understanding and recognizing, which is what we want. And of course, we're not there to fix all of these things. We're
Mhm.
there to help identify them and then refer out.
Absolutely.
But it's going to make such a difference, for clients, because often they are the ones that are unraveling with us in
Mhm.
that immediate postpartum as lactation consultants. So I think this is just, it really is something that we all need to have in our toolbox for
Yeah.
sure.
And we need to know how to talk to people who may be having a mental health problem without re-traumatizing them and without making the situation
Absolutely.
worse.
Yeah, so important. I couldn't agree more. That is wonderful. Well, this I know for sure is going to be, like you said, I appreciate you telling us that we're going to be able to take some of these tools and put them right into our toolbox. And of course, it'll be just a tipping point for some folks who are just starting to learn about this. And I know that you'll have lots of resources to take away too, so that the continuation of education in this area is going to be super valuable, especially for those who are starting out, and just learning. So thank you so much again for being here with us at Gold Lactation. It's going to be a fabulous event for sure. Now, Kristin and all of our other presenters are all online now. You can go check out Kristin's bio and learn a little bit more about her. It is on there. And again, the presentation, Eating Disorders in the Perinatal Client, a trauma-informed model. Thank you so much, Kristin, for being with us here today. I love hearing your stories. It's just wonderful.
Thank you so much. I'm excited about the talk.
Yeah, absolutely. Okay, folks, this is it. You get your chance to go to our website right now at goldlactation.com to register for this event. Kickoff date is April 4th, which is coming up really soon. And of course, you can come to that free event on the day with Melissa Cole. She's going to be our opening keynote, and that is open to everyone wide world. So all you need to do is register. But we hope that you'll come and join us and come and sit down and meet with Kristin. She's going to be here at the live event, which means that you'll have an opportunity to do one-on-one questions with her during the presentation. And of course, for our live Q&A, I can't wait to be able to sit down again and talk with Kristin further about this topic. So thank you again for joining us here today. Kristin Cavuto, thank you so much. And of course, to all of our audience, thanks for tuning in. Bye-bye for now, everyone.